So our adaptations can include, how long do you sit and look at a book? If it's 10 seconds versus 10 minutes, if that's where we start, that's okay. What kinds of games is the child interested in? And what do they play at home? Again, understanding the family culture. Do they like word games better than active games? Do they like books versus whatever? We're always fighting the iPads these days, and those kinds of games I teach parents to use sparingly because we know screen time is not the same as personal interaction. So helping the parents to understand that giving them an iPad and saying this is an educational game isn't going to be enough. Asking how frequently or intensively should we have that child practice, that's going to be adapted to, I often tell the parents, we're looking for teachable moments. If you have a teachable moment, go for it and get as much as you can. And when they're not in the teachable moment, don't expect as much. So how do we adapt that for both therapy and at home? For very young children, we often have to be sort of indirect. Let's play a game, and we're going to introduce different words or sounds or targets as part of our game, and we don't tell them, we're directly asking them to say this or do this at first until we gain more cooperation and imitation. We have to identify, sometimes we do, you call it a bribe. I call it external reinforcement. So when do we give parents permission, or when do we use something as a prize? So we're going to talk a little later about contingency as one of the treatments. And, having a work towards a reward with an understandable, target that we're going to get this thing done 5 times and then you'll get a reward. And, the reward can be a break. It can be escape. So what kind of external reinforcers are needed, and how do we build those in? And parents can help us understand what's motivating to their child and how long we can expect them to go before they need that reinforcement. And another way to deal with the intrinsic factors, again, is if that child has had a terrible day, once in a while it's okay to say, we're going to take a day to have just a fun day in speech, or we're going to have a day at home where we don't practice, because every once in a while the child might need that. The danger is taking that day off too often. But allowing that to happen sometimes can be very rewarding and reinforcing, and take some of that stress and burden off of the parent of feeling like, I didn't get it done today. When really getting it done as often as you can is the target, not focusing on you have to get it done every day.